Ovarian cancer is the 11th most common cancer and fifth leading cause of death among women. Now I'm going to talk about how cancer begins. It begins in cells. They grow and divide to form new cells, and when the cells grow old and then they die, and they make new cells to take their place. This orderly process goes wrong. The new cells form when the body does not need them, and old cells they die when they should. These extra cells can form a mass of a tissue called a growth or a tumor. Tumors can be benign or malignant. These tumors are cancerous. These tumors are generally more serious than other tumors. They begin more life-threatening and they can be removed, but sometimes they tend to grow red. These tumors can invade and sometimes damage nearby tissues or organs, and they spread to other parts of the body. So this is a slide of the cyst, and this is just spreading like a tumor, and this circle is the cyst. These ovarian cysts can be found on the surface of an ovary or inside it. The cyst contains fluid or it contains solid tissue. Most ovarian cysts go away within time. Sometimes a doctor will find a cyst that does not go away or it can get larger. The doctor may order tests to make sure that the cyst is not cancer. Ovarian cancer can invade, shed, or spread to other organs. Invade. Ovarian tumor can grow and invade organs next to the ovaries, such as the fallopian tubes and the uterus. Shed. Cancer cells can shed or break off from the main tumor. Shedding into the abdomen may lead to new tumors forming on the surface or the nearby organs and tissues. Spread. Cancer cells can either spread through the system to the lymph nodes and the pelvis, abdomen, and chest. Cancer cells may also spread through the bloodstream to organs such as the liver and the lungs. So this is just a picture of, this is the ovarian cyst, and this is the normal uterus. You can see that right here of all the cysts, this is just damaging, and that's just a regular one. The definition of cancer. According to Mayo Clinic, ovarian cancer is a type of cancer that begins in the ovaries and has 2 ovaries, one on each side of the uterus. The ovaries are about the size of an almond. Ovarian cancer often goes undetected until it has spread within the pelvis and abdomen, and it's at this late stage. Ovarian cancer is difficult to treat and it's often fatal. Ovarian cancer treatments are available. Researchers are studying ways to improve ovarian cancer treatment and looking into ways to detect ovarian cancer at an early stage. More cure is more likely. Staging. Your doctor may order tests to find out whether the cancer has spread. Stage 1. Cancer cells are found in both ovaries. Cancer cells may be found on the surface of the ovaries or in the fluid collected from the abdomen. So this is stage 1, and as you can see, it's beginning cancer in the ovary, and these are both ovaries, and it's on the surface of the ovary. Stage 2. Cancer cells have spread from one or both ovaries to other tissues in the pelvis. Cancer cells are found on the tubes of the uterus or the tissues of the pelvis. Cancer cells may be fluid collected from the abdomen. So this is stage 2. The cancer cells already broke off from the fluid of the abdomen and it spread to the bowel or the bladder. Stage 3. Cancer cells have spread to tissues outside the pelvis or to the regional lymph nodes. Cancer cells may be found on the outside of the liver. This is stage 3. Cancer cells are the lining of the abdomen right here, and the tumors are the small, like this is right here, and they break off into the lymph nodes. Stage 4. Cancer cells have spread to tissues outside the abdomen and pelvis. Cancer cells may be found inside the liver, the lungs, or in other organs. So as you can see in stage 4, it already had spread to the liver and other areas. Statistics. American Society estimates that in 2014, about 21,980 new cases of ovarian cancer will be diagnosed, and 14,270 women will die of ovarian cancer in the U.S. A woman's lifetime risk of developing invasive ovarian cancer is 1 in 72. A woman's risk of dying from ovarian cancer is 1 in 100. The relative 5-year survival rate is 44%. Survival rates vary depending on the stage of the diagnosis. Women diagnosed at an early stage have a much higher 5-year survival rate than those diagnosed at a later stage. 15% of ovarian cancer patients are diagnosed early. Women with ovarian cancer in 1975 experienced a 5-year survival rate of 36%. Today, the American Cancer Society estimate will be 43%. Ovarian cancer causes more deaths than any other cancer of the female reproductive system, but it accounts for only 3% of all cancers in women. According to EFCO's academic search, although evidence suggests that the majority of women experience a variety of nonspecific symptoms in the year before diagnosis, the disease is not commonly recognized until an advanced stage, leading to increased mortality and morbidity. The website Gale Virtual Reference Library explains different overviews on the source book of women's health concerns about ovarian cancer. So this is just a chart, and as you can see, the green is all the races and the other different colors of it. This is just how ovarian cancer started and how many people have it. This is how the death rate of ovarian cancer is. You can see it increased a lot most in all races, but specifically in white. The causes. No one knows what causes ovarian cancer. Cancers, they just grow and multiply out of control, and they die when they should. The symptoms of ovarian cancer. There's no specific to the disease, and they often mimic those of many others. More common conditions including digestive problems. Signs and symptoms. You can have swelling, bloating, pelvis discomfort, pain, nausea, changing in bowel habits, bladder changes, loss of appetite, you feel full really quickly, lack of energy, and low back pain. The diagnosis. You can have a physical exam, doctor checks signs of health. They press on the abdomen to check for tumors or an abnormal build of fluid. A sample of the fluid can be taken to look for ovarian cancer test. A pelvic exam. Doctors feel the ovaries and nearby organs for lumps or other changes in their shape or size. It may need a pap test, but it's not used to collect cells or detect it. An ultrasound. Aims sound waves in the organs inside the pelvis and it bounces off the organs. For a better view of the ovaries, they can use a transvaginal ultrasound. Biopsy is the removal of the tissue or fluid to look for the cancer cells. Based on the results from the blood test or the ultrasound, the doctor may suggest surgery to remove it from the pelvis or the abdomen. Treatment methods. They can have surgery, which they remove both of the ovaries and the tubes or the uterus. Sample tissue from the pelvis or the abdomen. Chemo, which is the most common one. It's anti-cancer. Drugs to kill the cells. More than one drug is given. It's given in several cycles. It can cut at the clinic, home, or a doctor's office, or mostly you go to the hospital to get it. It has side effects, but it depends on which drugs are given and how much. Blood cells fight infection cells and hair roots, cells that line the digestive tract. Radiation therapy. High energy rays to kill the cells, and it directs radiation of the body. The risk factors. Having risk factors doesn't mean that you're sure to develop ovarian cancer, but your risk may be higher than the average woman. Gene mutations. A small percentage of ovarian cancer are used by gene mutation. Family history. Women who have family member with ovarian cancer have an increased risk of the disease. If the woman family have history of cancer in the breast, uterus, colon, or rectum, may have a high risk also. Genetic tests can show specific gene mutations that increase the risk of ovarian cancer. If you have an increased age, it increases your age and it develops after menopause, though it can occur at any age. If you were never pregnant, older women that have never been pregnant have an increased risk of ovarian cancer. Menopausal hormone therapy. Some studies have suggested that women who have testosterone but itself for 10 or more years, they have a high risk of ovarian cancer. So what can you do? Prepare an appointment, write down symptoms you're experiencing, a key personal information, list of medications, take a family member or a friend along, write down questions to ask. Coping and support. Ovarian cancer is extremely worrisome and it's challenging. Even when a full recovery is likely, you may be concerned by a recurrence. So know what to expect. Find out enough about your cancer. ovarian cancer so that you feel more comfortable making decisions about your care. Find someone to talk to with, a friend or a family member with whom you feel comfortable discussing your feelings. Let people help. If you have friends or family who want to help, take them on their offers and let them know what is most useful to you. Set goals. Having goals helps you feel in control and can give you a sense of purpose. So take time for yourself. Eat well, relax, get rest, and combat stress. Prevention. There's no way to prevent ovarian cancer, but the only to reduce the risk is take birth control pills and discuss risk factors with your doctor. There are 20,000 new cases a year, and most times they catch it too late. I hope soon they can come up with a new test for this awful disease. Thank you.